Before I begin with my presentation, let me introduce myself first. I'm Kristine C. Baclion from SEA EE1C3. Now that I have finally introduced myself, let's get to the main topic. 6 drug categories and its example and side effects. Number 1. Central nervous system depressants. It is a medicine that includes sedatives, tranquilizers, and hypnotics. Examples are alcohol, barbiturates, benzodiazepines, opioids, and sleeping pills. Side effects of central nervous system depressants on people: poor concentration, headache, dizziness, dry mouth, problems with movement and memory. Side effects of central nervous system depressants on community: unstable, noisy, and can't work properly. Side effects of central nervous system depressants on family: can't talk or can't communicate well. Side effects of central nervous system depressants on individual: headache, dizziness, and poor concentration. Side effects of central nervous system depressants on physical: shaking, seizures, increased blood pressure. Side effects of central nervous system depressants on emotional: rapid heartbeat and irritability. Side effects of central nervous system depressants on psychological: hallucinations and anxiety. Number 2. Central nervous system stimulants. It is a medicine that speeds up physical and mental process. It is also used to treat ADHD or attention deficit hyperactivity disorder, narcolepsy, and migraine headache. Example of these are amphetamines, methylphenidate, atomoxetine, modafinil, armodafinil, pitolisant, and solriamfetol. Side effects of central nervous system stimulants on people: depersonalization, headaches, and panic attacks. Side effects of central nervous system stimulants on community: unstable, noisy, and can't work properly. Side effects of central nervous system stimulants on family: can't talk or can't communicate well. Side effects of central nervous system stimulants on individual: headache, dizziness, inability to sleep. Side effects of central nervous system stimulants on physical: body shake, manic behavior, increased blood pressure, and increased rate of breathing. Side effects of central nervous system stimulants on emotional: mood swings, irritability, and panic attacks. Side effects of central nervous system on psychological: depression, anxiety, and hallucinations. Number 3. Hallucinogens. It is a diverse class of psychoactive drugs that can produce altered states of consciousness that is characterized by major alterations in thought, mood, and perception, among other changes. Examples are LSD, psilocybin or magic mushroom, peyote or mescaline, DMT, ketamine or special K, and PCP or phencyclidine. Side effects of hallucinogens on people: loss of appetite, headaches, and panic attacks. Side effects of hallucinogens on community: unstable, disconnected from the environment. Side effects of hallucinogens on family: can't talk or can't communicate well, disconnected from the family. Side effects of hallucinogens on individual: headache, dizziness, inability to sleep, and weight loss. Side effects of hallucinogens on physical: sleep, hunger, increased blood pressure, increased rate of breathing, increased heart rate, and increased of body temperature. Side effects of hallucinogens on emotional: mood, irritability, learning, and memory. Side effects of hallucinogens on psychological: depression, anxiety, and hallucinations. Number 4. Dissociative anesthetics. It is a class of psychedelic drugs. It is a drug that causes people to feel detached or separated from their body and the environment. Example: ketamine, PCP or phencyclidine, DXM, nitrous oxide, and methoxetamine. Side effects of dissociative anesthetics on people: euphoric, relaxed, and numb. Side effects of dissociative anesthetics on community: unconscious of what's happening, disconnected from the environment, and unaware. Side effects of dissociative anesthetics on family: can talk or can communicate well, and disconnected from the family. Side effects of dissociative anesthetics on individual: numbness, confusion, dizziness, nausea, and vomiting. Side effects of dissociative anesthetics on physical: increased blood pressure, increased respiration, increased heart rate, and increase of body temperature. Side effects of dissociative anesthetics on emotional: memory loss, irritability, fear, extreme panic, invulnerability. Side effects of dissociative anesthetics on psychological: anxiety and hallucinations. Number 5. Narcotic analgesics. It is also known as opioid analgesics. Substances that produce morphine-like effects. They are primarily used for pain relief, suppression or diarrhea, replacement therapy for opioid use disorder, reversing opioid overdose, and suppressing cough. Example is codeine and oxycodone. Side effects of narcotic analgesics on people: sedation and dizziness. Side effects of narcotic analgesics on community: unconscious of what is happening, disconnected from the environment, and unaware. Side effects of narcotic analgesics on family: can talk or can communicate well, disconnected from the family. Side effects of narcotic analgesics on individual: numbness, constipation, dizziness, nausea, and vomiting. Side effects of narcotic analgesics on physical: relax, drowsiness, and slowed breathing. Side effects of narcotic analgesics on emotional: facilitate approach-oriented emotions, like for example anger and pleasure, and inhibit avoidance-oriented emotions like fear and sadness. Side effects of narcotic analgesics on psychological: increased anxiety. And for the last number 6, inhalants. Products that are easily brought and found in the home or workplace. They contain dangerous substances that have psychoactive or mind-altering properties when inhaled. Examples: solvents, aerosol spray, nitrites or prescription medicines for chest pain, spray paints, markers, glue, and cleaning stuff. Side effects of inhalants on people: overdose, seizures, and coma. Side effects of inhalants on community: unconscious of what's happening, disconnected from the environment, and unaware. Side effects of inhalants on family: can talk or can communicate well, disconnected from the family. Side effects of inhalants on individual: loss of appetite, sweating, problems of sleeping, nausea, and changes of mood. Side effects of inhalants on physical: liver and kidney damage, hearing loss, bone marrow damage, brain damage, and delayed behavioral development. Side effects of inhalants on emotional: self-harm behaviors, confusion, delirium, and apathy. Side effects of inhalants on psychological: slurred or distorted speech, and lack of coordination. And that's all. Thank you.